The biggest barrier to post-secondary education for youth in care isn't ability, it's access and affordability. Post-secondary education comes with costs most young people don't face alone. Their peers rely on family support, help with tuition, rent, groceries, and a place to come home to during holidays and summers. Youth in care are expected to do it alone. When financial support ends at 18 or 19, education doesn't become harder. It becomes structurally inaccessible. This isn't a personal failure, it's a policy failure. Equitable access to education for youth in care means that accessibility, security, and stability must be guaranteed and not be time limited. The Atlantic Tuition Waiver Project is examining tuition waiver policies for youth in care. These policies eliminate tuition costs at public institutions, directly removing one of the most immediate structural barriers to post-secondary access.
Hi there, my name is Jacquie Gahagan, and I am the Principal Investigator of a Social Sciences and Humanities Research Council study called the Atlantic Tuition Waiver Project. This 3-year study is looking at how tuition waivers can help reduce barriers to post-secondary education among care-experienced youth in the 4 Atlantic provinces. And a major key finding from that study is the fact that tuition waivers are the first necessary step in the front door. However, additional trauma-informed supports are also needed to ensure success. Thanks.
The early evidence is clear. When financial barriers are removed, access increases. Tuition waivers remove a critical barrier to access. However, opening the door isn't enough. Systems must ensure youth in care can stay in school, succeed, and graduate through wraparound supports. Tuition waivers address one barrier to access, but they are only a first step. Income stability policies, including extended post-majority supports that cover housing, food, books, and basic living costs, and measures such as the Guaranteed Livable Basic Income, create the conditions for youth in care to move from survival to stability and success in higher education. Education should not be a financial risk. It should be a realistic, supported pathway for every young person leaving care. Post-secondary education improves long-term income security, housing stability, and health outcomes. Investing in education for youth in care is evidence-based, preventative public policy with long-term social and economic returns. Access to post-secondary education for youth in care should be shaped by aspiration and ability, not by administrative cutoffs. As tuition waivers continue to move forward, learning how to holistically support youth in care via the Equitable standards for transitions to adulthood is one way we can help to ensure equitable access to post-secondary education. Visit the link in our bio to learn more about the Equitable standards and the Atlantic Tuition Waiver Study.